article? How do you read an article? It's a very introductory approach to getting comfortable with using, I would say, Google Scholar. For me personally, if you could walk away with something, I would like you to be able to get on Google Scholar, be able to find an article related to what you're interested in, and be able to quickly know how to read that article, like in a way that is efficient and useful. Because when we talk about evidence-based practice, a lot of y'all are in a program where, you're either going to be improving policy, you're going to be doing treatment plans, you're going to be thinking about how do we incorporate evidence into practice. And, part of that is being able to access the evidence, right? And so the evidence is what's the literature. You have your anecdotal experiences, and then you have evidence. Anecdotal experiences, that's like what you have seen in clinical practice, right? Or what your colleagues have, and you're like, oh my gosh, we should be doing this. I'm doing this. I know this helps patients. The important thing, though, like with healthcare, is we have all these policies and all these systems of what we have to follow. So the way to make it where it's a more standardized experience and we're following guidelines and rules that all the health systems have is we need to be moving evidence into practice. And that's where I think, if any of you are interested in research, sometimes you're going to find a gap. So you might know like something's really helpful, but you can find no evidence to change it. And so, like in my PhD, that's kind of one of the things I do is we generate evidence. Um, with a DNP type program, that's where they're saying, hey, this program worked for, let's say, the hemodialysis population. We think this might actually also be good. Let's talk about like cognitive therapy or something. Here's evidence of this specific intervention that worked with hemodialysis. We think this might also actually be good for patients in a state mental health hospital. This cognitive therapy, we should try this on them. And so that's where DNP will like take evidence and they evaluate the effectiveness of that intervention. So it's something already generated. Now, a lot of you guys are, in a master's program. That doesn't mean this is your terminal degree. You could go on, or it could be for you. Um, but it's still important for you to be able to know how to access the evidence because, if you're treating and prescribing patients and there's a better way to do something, there might be evidence, somebody said they did ICU. There might already be evidence about some treatment or intervention for ICU patients out there. And so it's already been tested, it's already been demonstrated to be effective, and you see the policy at your work is not using it, right? And this could improve maybe a practice gap somewhere that you're not hitting goals that you want to hit. Well, it's important for you to be able to look and be like, oh my gosh, look, here's an article. It demonstrates this is effective. I'm going to present this to our council that we should update our practices or our guidelines so that we are providing the best quality care to our patients. So that's kind of like the level that we're at here is can you get online and find evidence available that fits where you work?